Welcome back, everybody. Today we're tackling the opioid epidemic in America with, all the sources you guys have sent in, personal stories, expert analysis, even how it's hitting the workforce.
Yeah, I think it's going to be a really powerful look at the individual and societal struggles.
Yeah,
Yeah.
absolutely. And it's a tough one. But okay, so one of the first videos introduced us to Joe, a young guy battling opioid addiction. And it's really hard to watch his parents grapple with, his relapses, his journey in and out of recovery.
Well, and his story, sadly, is not uncommon at all. His journey, going from prescription painkillers like Percocet to heroin and then to fentanyl, tragically, that's a pattern we see so often.
Yeah.
As prescriptions become harder to get, the cheaper, deadlier alternative becomes the next step.
Yeah, and fentanyl is so potent. It's just terrifying. There's this moment where Joe's mom, she actually compares him to the devil, and it's just this vivid image, but it really speaks to the stigma around addiction.
It really does. And it reminds us that addiction isn't a moral failing. It's a disease, and it really hijacks the brain's reward system. And when opioids enter the picture, they attach to these receptors, flooding the brain with dopamine, which is, the pleasure neurotransmitter.
So the brain just gets hooked on that intense reward and just keeps craving more.
Exactly, yeah. And so over time, the body builds up a tolerance, needing higher doses to achieve that same effect. And that leads to physical dependence and, the agonizing experience of withdrawal.
Yeah, one chronic pain patient in the videos described it as like having your tissues ripped off your bones. It's hard to even imagine.
Yeah, it's a very visceral description, but it really reflects just how brutal opioid withdrawal is.
Yeah.
And as that tolerance increases, so does the risk of overdose. It's a terrifying, life-threatening cycle.
Yeah, and it goes way beyond the individual struggling, right? We saw Michelle and Chuck raising their grandsons after their daughter Michaela overdosed on fentanyl.
Right, and this speaks to the intergenerational trauma that the opioid crisis is creating. And then we have Anna, adopted, but carrying these deep scars from his biological father's heroin use, wishing he was stronger so he could have woken his dad up.
Oh, it's heartbreaking. The innocence lost because of this. And then on top of that, we see the economic fallout, right? Employers are struggling to find workers who can pass drug tests.
Yeah. And this ties into, I think, a larger issue that we're seeing now where studies are linking this increase in opioid prescriptions to a decline in workforce participation.
Yeah.
So productivity plummets, industries become unstable. It's huge.
Yeah, and we met Scott, a skilled machinist who lost everything to addiction. He's in recovery now, wants to work again, but man, the obstacles are huge.
They are. And it leads us to this question of, how did we even get here?
Mm-hmm.
And one thing we have to look at is the role of pharmaceutical companies. The video about Purdue Pharma and McKinsey and Company was, it's disturbing.
It is, yeah. Their aggressive marketing of OxyContin downplaying those addiction risks, it's infuriating. And then McKinsey proposing rebates for pharmacies based on overdose rates.
Yeah, and it really raises serious ethical and legal questions, prioritizing profit over human life. I mean, the consequences of those decisions are still unfolding today.
So is there any hope? Are there effective ways to fight back against this epidemic?
Well, there are. There are various approaches, and they spark a lot of debate. Some of them fall under what's called harm reduction.
Harm reduction. Okay, break that down for us.
Sure. So it's a public health approach that focuses on minimizing the negative consequences associated with drug use rather than solely pushing for abstinence. So this could include things like needle exchanges or safe consumption rooms.
Well, like those facilities in Denmark, right?
Exactly. And the video actually showed a Danish police officer whose views on drug users completely changed after meeting this homeless addict named S. And it really highlights that need for empathy and, more humane approach.
It sounds like a powerful example of how, shifting perspectives can lead to more effective solutions.
Absolutely. And then you have the whole question of treatment and recovery. We saw individuals, battling heroin addiction, the struggles they faced, getting help, overcoming the stigma.
Like Tessa, that young mom fighting to stay sober for her daughter. Her story it stayed with me.
It really does. And it underscores these incredibly high stakes and the importance of, accessible, effective treatment. And then we learned about methadone and buprenorphine and their role in managing addiction.
But those are controversial, though, right? Some see them as just swapping one drug for another.
Yeah, that's a very common misconception. Methadone and buprenorphine are medications that help manage withdrawal symptoms and cravings, allowing individuals to, focus on rebuilding their lives.
So they're tools for recovery, not just substitutes.
Exactly, yeah. And it's also, I think, crucial to address co-occurring mental health issues, too. Addiction often intertwines with depression, anxiety, trauma.
Yeah.
It's not a simple problem.
Yeah, it's not. We're seeing how interconnected this crisis really is.
Oh, absolutely. It's a complex web of social, economic, and medical factors, and
Yeah.
we've got to look at it from all angles to understand it.
And we're just scratching the surface here. We haven't even touched on fentanyl's emergence as the deadliest phase of this whole epidemic.
Right. That's where we'll pick up in part 2. Fentanyl is really changing the game, and understanding its impact is crucial to answering that question. Is America winning or losing this fight?
You mentioned fentanyl changing the game, and that Bloomberg video, they called it the deadliest phase of the opioid epidemic. It's scary stuff.
Yeah, it's really the potency that makes fentanyl so dangerous, up to 100 times stronger than morphine. I mean, even a tiny amount can be lethal.
They compared it to just a few grains of salt being enough to cause an overdose. It's like playing Russian roulette every time.
It is, and it's not just, those intentionally seeking fentanyl who are at risk. It's being laced into heroin, cocaine, even counterfeit pills, so people might not even know they're taking it until it's too late.
So it's not just a problem for like what we might think of as hardcore drug users. It's affecting so many more people.
Oh, absolutely. And the fact that it's cheaper and easier to produce than heroin makes it that much more pervasive. The chemicals to make it are often sourced from abroad, and then it's manufactured illegally, often in Mexico.
So it's this whole supply chain that crosses international borders that makes it almost impossible to control.
It really does. And we saw how Florida Governor Ron DeSantis is trying to tackle this, increasing penalties for, sale and distribution. But he's also advocating for treatment options like naltrexone and methadone.
Wait, naltrexone, you mentioned methadone before, and buprenorphine. How does naltrexone fit in?
Right, so it's another medication used in opioid addiction treatment, but it works a bit differently. Methadone and buprenorphine, those help manage withdrawal symptoms and cravings. Naltrexone, it blocks the effects of opioids so the person doesn't experience the high.
So it's more about preventing relapse than dealing with the physical dependence.
Exactly, yeah. It can be a really helpful tool for people in recovery who are trying to avoid those triggers and stay sober. But just like any treatment, it's not a magic bullet. It needs that comprehensive approach, therapy, support, all of that.
Yeah, makes sense. DeSantis seems to be taking that multi-pronged approach, going after supply, but also boosting access to treatment. But some of these harm reduction strategies, like syringe exchanges and fentanyl test strips, they still get a lot of pushback.
Yeah, and I think that debate really highlights the complexities of this whole issue. Some people argue that harm reduction just enables drug use, while others say it's a pragmatic way to save lives and reduce the negative consequences.
That video from The Guardian about the UK's approach was interesting. They're worried about this fentanyl surge, and they're looking at what's worked in other countries.
Right, and they're specifically looking at safe consumption rooms. So these facilities, like the ones that have been operating actually quite successfully in Denmark for over a decade, they provide a supervised environment for people to use drugs.
Yeah, I remember that Danish police officer's story. He wasn't so sure about safe consumption rooms at first, but after actually seeing the impact, fewer overdoses, less public drug use, more people getting treatment, he totally changed his mind.
It's such a powerful example of how challenging our assumptions and really looking at the evidence can lead to better solutions.
Yeah.
Harm reduction is about meeting people where they are, minimizing those risks, rather than just judging or criminalizing.
It's definitely a more humane and compassionate approach, but with fentanyl being so potent, the stakes are just so high.
Oh, absolutely. There's no denying that. We need this multifaceted response that involves prevention, education, treatment, and harm reduction. We need to keep talking about it, exploring these different perspectives, being open to new solutions.
There's a real urgency here, especially with fentanyl's rise. We can't just sit back and wait.
You're right. We need to act, and act strategically, to address this crisis that's always evolving. There's no one-size-fits-all solution, but by combining evidence-based strategies with empathy and a willingness to learn from, what other countries are doing, we can make progress.
Learning from other countries, yeah, that seems key. Are there any specific approaches that are working really well?
Well, Portugal decriminalized all drugs back in 2001, and that's often brought up as a possible model. So instead of treating drug use as a crime, they treat it as a public health issue. They offer treatment, harm reduction, social reintegration programs.
And how has that worked out for them?
The data shows that Portugal has seen a significant drop in drug-related deaths, HIV infections, and even overall drug use since decriminalization. It's complicated, of course, and there are other things to consider, but it definitely makes you question that traditional approach of just, locking people up.
So maybe it's not about being tough on crime, but about being smart and compassionate in how we respond.
Exactly. We can't just rely on simple solutions. We need a much deeper understanding of this whole problem.
We've talked about the impact on individuals, families, communities, but there's also this question of accountability. Like, who is responsible for letting this crisis get so bad?
That's a big question, and one that's being dealt with in the courts. We saw the video about the national opioid prescription litigation, where communities are holding distributors accountable for, flooding the market with these addictive drugs.
It was crazy to see those numbers, millions and millions of opioid pills going to these small towns.
It's a clear example of how corporate greed and negligence played a role in the scale of this epidemic. And those legal battles are still going on, with people seeking justice and compensation for all the damage that's been done.
It makes you think about regulation, oversight, and the responsibility of the pharmaceutical industry to put public health before profits.
Absolutely. We need to look at the systems that allowed this to happen and make sure we have stronger safeguards in place so it doesn't happen again.
It feels like things are starting to shift, like there's a recognition that this isn't just about individual choices, but about systemic failures and corporate accountability.
That's a huge step.
Mm.
And by acknowledging all the different things that contributed to this, we can start to develop more effective solutions.
It sounds like we are moving in the right direction, but there's still a long way to go.
There is. But as we've seen in this deep dive, there are reasons to be hopeful. Communities are working together, innovative approaches are being explored, and we're finally having more open and honest conversations about addiction. It's going to take effort and collaboration, but I think we can make a difference.
One thing that struck me was the resilience of the people in these videos. People like Joe and Tessa fighting to recover, families stepping up to care for the kids affected by all of this. It's inspiring.
It really is. And those stories of resilience and hope are so important. They remind us of the human cost, but they also show us the power of the human spirit to overcome. We can't forget those stories.
It feels like we've covered so much, but there's still so much to explore. What's the most important takeaway so far for you?
Well, for me, it's realizing just how complex this whole thing is.
Yeah.
There are no easy answers. We need to be empathetic, open-minded, and really understand that it's a combination of individual choices, corporate greed, systemic failures, and societal stigma. We need to challenge what we think we know, look at the evidence, and be willing to try new things.
And maybe most importantly, listen to the people who are directly affected by this. Their stories and experiences are so valuable, they should be guiding our efforts to make real change.
Absolutely. Their voices are crucial if we want to have a more just and compassionate response to this devastating epidemic.
This has been a really eye-opening conversation. But before we wrap up our deep dive into the opioid epidemic, we have one more crucial area to explore: the impact on children growing up in the middle of all this.
Right, that's a key piece of the puzzle. We've seen hints of it in these videos, but we need to dig deeper into the challenges they're facing and the long-term consequences for, all of us.
Yeah, it's hard to even grasp the ripple effects, especially on kids. We've seen kids raised by grandparents put into these overwhelmed foster care systems, even born with, neonatal abstinence syndrome because of their parents using opioids.
Right, and the trauma they go through, it can have consequences that last their whole lives. Development, mental health, forming relationships, it's all affected by the chaos and instability that comes with addiction.
The story of those three siblings, Zachary, Eliana, and Asia, it really got to me. They were bounced around the foster system because their mom and grandmother were both battling addiction. What kind of future do these kids have? It makes you wonder.
It really does. And it highlights how badly we need these comprehensive support systems. Early intervention, mental health services, trauma-informed care. We have to break this cycle and give these kids a chance.
It's like we're talking about a lost generation, scarred by all of this.
And we can't let that happen. Investing in these kids, it's not just the right thing to do, it's an investment in our future. Their well-being is tied to the health and stability of our society. It's all connected.
Okay, so we've talked about individual stories, the impact on society, the role of these companies, but in the end, is America winning or losing this fight against opioids?
I don't think it's a simple yes or no. We are seeing some progress, right? More awareness, treatment options, understanding of harm reduction, but fentanyl is a huge challenge.
It does feel like a race against time. We're making some headway, but fentanyl is just spreading so fast, taking so many lives.
And that's where this whole question of accountability really matters. That video about the national opioid prescription litigation, communities going after distributors for their part in this, It's a step toward justice.
Holding these powerful people accountable. Yeah,
Yeah.
it's powerful.
Yeah, the lawsuit argues that distributors didn't do enough to monitor and stop suspicious orders of these opioids, so that contributed to the oversupply.
Yeah.
It's about acknowledging those system failures and making sure it doesn't happen again.
They mentioned 780 million prescription opiates delivered to West Virginia in just 6 years. And that's a state with less than 2 million people. It's mind-blowing.
Those numbers are hard to ignore. They really show the scale of this crisis. And legal action is important, but we also need to focus on prevention, education, reducing stigma. We need a culture where people can ask for help without feeling ashamed.
What stands out to you most from all of this? What should our listeners be thinking about?
I think the biggest thing for me is realizing just how complex this crisis really is. It's not just one thing. It's individual choices, corporate greed, failures in the system, the stigma around addiction. There's no easy answer, but there are some things that give me hope.
Yeah, those stories of people fighting back, communities coming together, the push for harm reduction, it shows us that things can change.
Right, exactly. This deep dive has been a real wake-up call about what happens when we don't act. But it's also a call to action. We all have a part to play in ending this. Educating ourselves, supporting harm reduction, pushing for policy changes, we can all make a difference.
So to everyone listening, what role will you play in all of this?
Remember, knowledge is power and empathy is so important. If we understand how complicated this crisis is and we approach it with compassion, we can build a future where addiction doesn't have this devastating hold on our society.